hit the recording and we shall start. Okay. Good morning, everybody. My name's Sejal Patel, and I'm going to be doing the Medicare presentation today. But before we get started, I wanted to introduce you to Deepa Rao, who is a part of AAIWO, and she's going to introduce you guys a little bit about the program and what they offer. So Deepa, to you.
Thank you, Sejal. My name is Deepa Rao, and I'm the current president of AAIWO. AAIWO is a 501(c)(3) nonprofit organization for Asian Indian women promoting professional development and education through scholarships and outreach programs. Our aim is to foster and support women for personal and professional advancement while providing volunteering opportunities. AAIWO promotes culture and education while establishing productive social networks for women. AAIWO sponsors multicultural activities to promote our culture understanding in our community. So, service wings of AAIWO is Women in Need. AAIWO is an organization that is committed to helping women. We have our helpline. The phone number is on our website. So, our helpline phone number provides women in crisis free professional help from qualified consultants. Calls are received from women in situations of domestic abuse or women confused about immigration status or career changes. They receive information about their options and rights, which helps them to make correct decisions about their lives and future. All calls are confidential and information is obtained as strictly confidential. The helpline has played a pivotal role in helping women and change their lives for better. Over the years, it has helped many women in situations of domestic abuse, financial distress, and navigating immigration law challenges. We also have Saheli, the single women group. We have Columbus chapter and Cleveland chapter. This group welcomes women who are single, divorced, widowed, or single by choice. We organize social outings and get-togethers for single women. We establish a support group for single women. So this also helps women in need. We also have AAIWO Scholarship. We have dedicated group of women who have raised funds to help and assist to our community. These funds are managed by Cleveland Foundation. Each year we give out 2 scholarships, and this award is based on the guidelines provided by AAIWO. And yeah, over to you, Sejal. Thank you.
Okay, thank you, everybody. So I wanted to start off by really just talking about the presentation today and Medicare. You know, Medicare is can be a very complex journey. Many people believe that, you know, it's super simple and I just apply and I'm good to go, but it is quite complex. So my goal of my presentation today is really to kind of give you a window into the Medicare process and hopefully guide you guys through the basics. And at the end, hopefully we can have some conversation and questions around Medicare and their needs in the process that happens. So I'm going to go in and share my screen with you guys and we'll start our presentation. All right. So hopefully everyone can see. Medicare is, again, a healthcare journey. It is a big process, quite confusing. And today's presentation, we're going to focus on the basics of Medicare and what Medicare requires us to do. So on average, a healthy retiring couple at the age of 65 can spend anywhere up to $351,000 on Medicare throughout their retirement process. So that's quite a bit of money. And that's because people think that Medicare is free, but however, Medicare itself, there are premiums to it, and there are cost sharings that go along with Medicare. So what we're going to learn about today is what is Medicare, the basics of Medicare Part A, Part B, Part C, and Part D, your enrollment periods in Medicare, what Medicare Advantage is, which is also called Part C, your prescription drug coverage, which is your Part D, what's a Medicare supplement or a Medigap? Oftentimes that word is put out there and synonymous sometimes with Medicare Advantage, but they're 2 different things. Medicare costs, and what the differences are between Medicare Advantage and Medicare supplements, And last, we'll talk about financial assistance programs that can help out with some of your Medicare costs if you are a low-income family. So what is Medicare? So Medicare, it's a federal health insurance program that's offered to United States citizens and its legal residents. You have to be in the country for 5 years under a green card, and you will be eligible for it. And it's an individual insurance plan. So you and your spouse would be on two different plans. It would not be you alone and with your spouse on one plan. And it's partially funded by the taxes that you pay throughout your working history. It is not free. And Social Security and Medicare are two different things. Oftentimes people confuse it and they think it's Social Security. Social Security Administration does administer, or you can apply through the Social Security Administration, but Medicare in itself is a separate entity than Social Security. And it's not Medicaid. Medicaid is your state-run insurance program for those that are underserved and underprivileged and don't have the income. And that state insurance is called Medicaid. And again, Medicare is a federally insurance program. So when do you apply for Medicaid? 65 is usually the target age where everybody hears that that's your retirement age. So a lot of people do enroll in Medicare at 65. If you're going to take Social Security benefits at that time, your cash portion of your Social Security benefits, you'll automatically be enrolled in Part A, which is your hospital insurance. You'll automatically be enrolled, but you will have to enroll in Part B. If you're still working at 65 and you're planning on retiring at a later date, you actually don't have to enroll at that time. I always suggest people, Part A, if you've worked in the country for 10 years or 40 quarters and have paid into the Social Security system, it's always good and easy just to apply for your Part A because it is free and is not premium for those that have worked in the country for 10 years. You can make an appointment at your Social Security office, or an easier way to apply is actually through online. You can go to www.medicare.gov and apply through the Medicare portal, which is the easiest way and the quickest way, and that way you can keep track of your application. What I always also suggest is when you're turning 64 is actually talk to a licensed Medicare broker who's independent, so they can really help you understand about Medicare and understand about the processes and about penalties and things like that. We are going through this presentation and I'll give you general information, but it's always good to talk to someone in person or over the phone that can actually talk to you about your specific needs. So that's what's really important. So your initial enrollment period, starts 3 months before your actual birthday month. It includes your birthday month, and it is 3 months after. So you have total of the 7 months before and after total of your birthday to enroll. During that time, you can enroll and you would not be subject to a penalty. If you enroll after that and you're not working, you would be subject actually to penalties, and we'll go over penalties in a little while. But important to know, your first 7 months around your birthday, 3 months before and 3 months after, is called your initial enrollment period. So in lieu of that, there's also 3 other major enrollment periods. The first one, it comes up annually. It's called your open enrollment period, and that's from January 1st through March 31st. That enrollment period is for those individuals that do not go in and apply for Medicare during their birthday at 65, their initial enrollment period, and they decide to enroll later on. they will have to enroll between January 1st and March 31st. Every year, there's also what's called an annual enrollment period. So for those individuals that are on a Medicare Advantage program or a Medicare supplement program, and they want to review their plans and change for the following year, every year on October 15th through December 7th, you can make a plan change for the following year to come. So again, this is annually, it comes up October 15th through December 7th. And the last you could see is called a special enrollment period. And what a special enrollment period is it's a time where you can apply to Medicare and or Medicare Advantage plans, and it has a qualifying life-changing event that occurs in order for you to apply to the programs at a different time than your open enrollment period. So it's really important to remember these three dates. So let's talk a little bit about what actually triggers a special enrollment period. They talk about, and they say it's a life qualifying event that can trigger it. So below, there's a few categories that could be considered life-changing events. First is moving. So if you are moving from your current permanent residence and you're moving to a new service area, that includes, for example, for those of you currently are in Ohio and you're living in Cuyahoga County, and then you move to Lake County, for example, the county change is considered a residence change, and it's moving to a different service area because Medicare Advantage plans are attached to and organized by county. So you would have what's called a life-changing event. If you're losing your coverage, many people lose their Medicaid coverage on and off. So if you have a Medicaid and you lose Medicaid, or if you had an employer-sponsored plan and or a union-sponsored plan and you lost the coverage, whether it's through retirement or whether they, drop coverage as a whole, that would trigger you to have a special enrollment period. If you had a plan change, and what that means is Medicare itself contracts with insurance companies and establishes different plans that the insurance companies are going to offer. Sometimes Medicare and the insurance company decide to do a non-renewal or have a termination of contract. And if something like that occurs with a plan that you're in, you would be eligible for a plan change. Next is financial assistance. And what that is in the Medicare program, there are what's called Part D extra help. Part D is your prescription drug plan. For those individuals that are low income, the government offers this extra help to help pay for and offset the costs of your prescription drug plans that you get from your pharmacy. And they also have a plan which is called a Medicare Savings Program. So the Medicare Savings Program, it is based on what your Medicare, if you have Social Security income and or retirement income that qualifies you for it. There are financial parameters for you to qualify, but if you do, it can help take care of your premium costs for your Part A or your Part B. And that qualification and the process of actually applying for that is actually administered by the state. It is not administered by the federal government, so you cannot call Medicare.gov. You would actually call your local Medicaid office and ask them to see if you can apply for the Medicare Savings Program, and they can help you through that process. There's also another program called the State Pharmaceutical Assistance Program. So if you are enrolled or you're dropped from that program, that also triggers a life event. And then the other pieces are if you had an exceptional situation where you signed up for Part A and Part B at a different time and it qualifies you for that, or if you have a serious medical condition. Many times we go into a situation where a doctor might diagnose us with diabetes or heart disease or whatnot. Those are considered life-altering illnesses, and therefore it would open you up to qualify for special insurance programs that Medicare Advantage plans offer, and therefore you would actually be able to sign up at that time. If you had a natural disaster in your community, that also gives you a special enrollment period. And sometimes if you have an unexpected situation, so for example, if you're um, have an unexpected hospitalization, you're dealing with temporary cognitive disabilities, or there's some other type of national or state emergency, it can also qualify you for a life-changing event. So as we talk about Medicare, I think one of the most important things I talk to all my clients about is really the key is to be prepared. Understand Medicare, understand your options, and understand how you can best manage your healthcare costs. So let's talk about actually the Medicare plans and the different parts. So most individuals are eligible for Medicare when they turn 65. And there's four major parts to Medicare. Part A is your hospital coverage. Part B is your doctor coverage or anything that's considered outpatient. Part C is what's called a Medicare Advantage plan, which is a plan that you can add on to your original Medicare to help minimize your out-of-pocket costs. And then Part D is your prescription drug plan. When you join the Medicare system, Part A and Part B, as well as Part D, as in dog, are all required for you to enroll in order for you not to face any kind of penalties in the future if you do enroll. So let's talk a little bit about Part A and what we consider the hospital stay and inpatient care. So Part A covers anytime you're inpatient, if you have a surgery or any kind of operation that happens, if you have anything inpatient wise, labs and x-rays, MRIs, if you're in an ICU or a specialty care unit, your room and your meals, any of the inpatient medications that you receive or medical supplies, your nursing, skilled nursing that you have. Blood transfusions are covered under there, hospice care as well. And if you were in the hospital and you had to get admitted to a skilled nursing rehab as a step down before you get to go home, that also would be covered under Part A. And lastly, part-time inpatient home skilled nursing. That is for someone that goes home and let's say they're still not able to do what are called essential daily activities of living and they need support with that, then Part A would be the place where they would send someone home to you. Typically, can be up to 35 hours a week of support and help so that you can maintain your active daily living processes. Part B. So Part B is your medical insurance that covers your doctor services and outpatient, as I mentioned before. So when your doctor visits you, it's kind of interesting. So when your doctor visits you inpatient, the charge is actually on the Part B side of the insurance. If you visit your doctor at their office, it's also under Part B. Your annual visits to your doctor and any kind of preventative services that you have would be also considered Part B. Labs and anything that you do outpatient, also under Part B. Same thing with your medications and any kind of diagnostic testing, physical therapy, occupational therapy, speech therapy, any of those things. If you had to have an ambulance come to your home, or you now need a wheelchair, or you need mental health support, or diabetes education, or supplies and screening, all that would be considered Part B. So when you talk about Part A plus your Part B, and you hear people, they'll say, do you have original Medicare? So when they're speaking about original Medicare, it means that you have both Part A and Part B together. So let's talk a little bit about premiums and what the premiums attached to Part A and Part B are. As I mentioned earlier, If you've worked in the country for 10 plus years and paid into the Social Security system, which is also 40 quarters, you would be paying $0 for your Part A hospital coverage. If you've worked that between 7.5 years and less than 10 years, you'd be actually having to pay $218.50 per month for Part A. And if you have not worked in the country or worked less than 7.5 um, years in the country, you're going to be paying $518 a month. So that's a um, huge amount of money to be paying for insurance. So it's super important to know that, again, if you haven't worked in the country, it's a huge amount. So just be mindful of that. It is not free. Part of Part A, when you get the plan, there is a deductible when you get admitted to the hospital. The deductible is $1,676 upon an admission for up to 60 days. After those 60 days, if you were in the hospital long term, then you would also be paying a co-insurance of $418 per day. There is no cap on the out-of-pocket max for the hospitalization or Part A benefits. What I mean by that is if you, for example, went into the hospital today and you were admitted, you have to pay that 1676 for your deductible, and it would cover up to those 60 days of admission. But let's say 2 months later, you had to go back in, you would again have to pay a 1676 hospital admission deductible. There is no cap. So you can see how if you are someone that, may have in and out of the hospital or have complex issues, it's super important to have something that is attached to your original Medicare to help offset those costs. So Part B, which is your outpatient coverage, that in 2025, the annual income of $106,000 or below, you would actually be paying $185 per month. And that is for everybody, whether you've paid into the system or not. The fee for Part B is for everybody for as long as you have Part A and Part B. You would always be paying that. The premium amount that's set for that $185, that one is for anyone who, again, whose income is below $106,000, but there is a chart. It is called the IRMA chart, which I'll share with you in a minute, which shows a chart what your premium would be based on your income. It's similar to like having a tax bracket, but this is a income based bracket for what your premiums would be on month-to-month basis. In your Part B, if you just had original Part B, you have an annual deductible of $275. And then what happens is you do a split of cost sharing. Medicare covers 80% of your outpatient billing, and then you would be responsible for 20%. And again, there is no cap for that Part B sharing. Here is a quick view of what's called your income-related monthly adjustment amount, which is your premium, and it's based on your income. So you can see as you make more money, your premium will go up higher and higher. The max is for 2025 is $628.98. And this chart is actually updated annually. So there's usually a little bit of a change on an annual basis that you will see in your Social Security check if you are retired. If you're not, you typically will get a bill on a quarterly basis for that $185 per month, and you would see the change if it went up in the annual year. So let's talk a little bit about late enrollment penalties. So as you can see, Part A, Part B, and Part D, each can have a penalty attached to it if you do not enroll in a timely fashion at the age of 65, or if you're working after you lose your what's called credible insurance, you don't enroll in Medicaid, then you can be subject to penalty. For Part A, you can have a 10% penalty added to your monthly premium for twice the amount of years that you've delayed enrollment. For Part B, there's a 10% penalty for every 12 months that you have not enrolled in Part B. And that penalty, again, remains for a lifetime. For as long as you have a Part D premium, you will be paying that penalty. Part D has a 1% penalty for the average premium of Part D, and for every month that you delay. So I have a scenario to kind of share with you after this, but just a reminder, you will not be assessed a penalty if you, one, enroll under your initial enrollment period when you turn 65 and you enroll in Part A, Part B, and a Part D, or if you work past the age of 65 and you have employer-based credible coverage until the time that you retire. And what credible coverage is it has to be basically your company that you work for must be a company that has 50 employees or more, because those plans offer the same level of coverage that basic Medicare does, and therefore that would be considered credible coverage. For those of you that get insurance on the open marketplace, it is not considered credible coverage. And or if you are waiting, for example, some of you who may have come here at the age of 50 from a different country and are waiting for your time of 10 years of employment in this country in order to apply, that will be considered a delay, because when you're in this country 5 years on a green card, you're automatically eligible at 65 to get Medicare. And if you don't enroll, you will be subject to penalty for that. So it's super important to remember when and where you could be assessed for penalty. So Part A penalty example, a person turned 65 and qualified for Medicare Part A in July of 2022, but they forgot to enroll until September of 2025. So it's a delay of 3 years, and that person had to pay a $278 premium for 8 years because of the delay. And so you could see right down below, I've kind of broken off why the delay was there and what the amount that was going to charge them. You can see here, it's a similar situation. A person is 73 and they're qualified for Medicare Part A in 2020. And after living in the US for 5 years on a green card, they didn't enroll in, they didn't work in the United States at all. They delayed their enrollment in Medicare Part A until August of 2024. Their monthly premium, because they had not worked in the country, was $514 because of the, again, no work history. So the penalty for that is you're a 4-year delay. So you double that, which is 8 years, and it's a 10% penalty. So it's $51.40 per month that's added to your monthly premium of $514. So it's $565 a month and 40 cents a month. And you have to pay that for 8 whole years. So that's a long time to be paying that penalty. I have a little scenario here also for Part B penalty. If you look here, the person A turned 65 and qualified for Medicare Part B in July of 2022, but they forgot to enroll again until September of 2025. The monthly premium for Medicare Part B, as we discussed before, it's $185, and they delayed for 3 years. So if you look below, their premium went from $185 per month to $240.50 per month. And it's for as long as you have Part B. So if the individual lives for till 85, imagine that's going to be $11,988 that they're going to have to invest in penalty premium just because of the fact that they did not enroll. And lastly, I'm just showing you a quick Part D penalty. Again, similar scenario as the person A who delayed for 3 years. The average premium for a Part D plan on the open market is $49.95. So based on that, the delay was going to cause the person a 36-month penalty. So it's 0.1% times 36, which is 36% penalty of the $49.95, which is a $17.82, which is going to be added to their monthly premium. So it's going to be $67.77 per month for as long as you have Part D as in dog. And again, you're going to be paying $3,625 approximately over a lifetime if you live till the age of 85. So as I mentioned, late enrollment penalties are applicable. So it's super, super important. Lastly, right here, you can see a Part C. The Part C piece, you do not get a penalty. There is no surcharge for that if you enroll in a Part C plan, as long as you enroll within 63 days of losing your credible coverage, or you enroll in your Medicare Advantage plans. So let's talk a little bit about options beyond Original Medicare. As I mentioned before, Original Medicare is Part A plus Part B. You have those options, but as we talked, there's no cap on cost. And so to help minimize the cost, there are some options out there that we can choose from. Option 1 is you can add what's to your Original Medicare, something that's called a Medicare supplement plan. And it's offered by private insurance companies, and it's kind of like an umbrella plan. It helps you pay for some or all of the costs of Original Medicare Original Medicare that doesn't cover. You can pick different plans, and based on those plans that you choose is how much you would actually contribute to the cost. And those Medicare supplement plans do have a monthly premium attached to them. So you would be paying a monthly premium for as long as you have the Medicare supplement plan. And then you also would have to do a Medicare approved prescription drug plan, which is called a Part D plan. And it's also, again, offered by private insurance companies. And those prescription drug plans do have a premium attached to it. Some companies like WellCare may have a $0 for their savings programs. And some of the other private insurance companies like Aetna, Humana, United, they have plans at different levels. I've seen plans that cost to $70 to $80 a month. And that's why it's super important to talk to someone that understands Medicare supplements and Part D plans, so they can actually look up your medications to make sure what plan would fit for you. Now, the option 2, it's called a Medicare Advantage plan, or sometimes you'll hear Part C. They are also offered by private insurance companies. What they do is they combine both Medicare Part A and Part B into one plan, and it usually also offers the Part D as well in the plan. The plans also sometimes offer additional benefits such as dental, vision, food, and home card, sometimes a gym membership as well. Many people enjoy this Medicare Advantage plan because if they're on a fixed income, a lot of Medicare Advantage plans do not have a monthly premium cost. One of the things to know is that when you join a Medicare Advantage plan, your Medicare Advantage plan becomes your primary payer. And Medicare, it's basically your Medicare becomes privatized. So that's quite different than being on option 1, which option 1, you would have your billing go through Medicare, Original Medicare, and whatever your balance left over will be sent over to your Medicare supplement plan. And for option one, you would actually also have to find dental and vision outside of for a premium cost. So those are the two major differences. So again, Medicare Advantage plans, which is also Part C, it's kind of one all-in-one kind of plan. It covers your Part A, your Part B, as well as your gives you those extra benefits, sometimes over the counter, gym membership, um, um, that people enjoy, and also hearing as well. So in terms of Part C Medicare Advantage plans, there's different types of Medicare Advantage plans that are offered. There's HMOs, or health maintenance organizations, and those are organizations that limit your network of doctors and hospitals that you can get services from. There are PPO plans, which open up your network, and you can go and see any provider that you'd like or hospital, but your cost share would be much higher. With HMO plans, typically you need a referral to see a specialist, but if you see the point number 3, it's called point of service plan. That's usually attached to an HMO plan. And what that means is basically it's a plan that offers you the opportunity, even though you have a closed network, you can go see a specialist without a referral. Special needs plans, or sometimes called SNPs, those plans are offered to individuals first that are on a DSNP, which is someone who's on Medicaid and Medicare. They're offered special Medicare Advantage plans that help to meet their needs. Chronic illness plans, so those individuals that have qualifying chronic illnesses, some of them are, again, diabetes, kidney disease, heart disease. Those plans are called C-SNP plans that oftentimes help to contain costs even further and have smaller copays to see their specialists on a regular basis, encouraging people to, get regular medical attention. An institutional special needs plan, that's for one who's in a nursing home. They can also get an attachment to their Part A that helps to cap their costs for nursing home costs. And institutional equivalent special needs plans are called ESP. And those, again, are for people that are in institutions that are not what a nursing home, or sometimes they're living at home and they can qualify for one. Private fee-for-service plans, they're very limited, but they do offer those, as well as a Medicare savings account plan. So those are different types of Part Cs that are offered. So let's talk about a few facts of Medicare Advantage plans. You must be enrolled in a Part A and a Part B, and live in the county where the plan is offered. There is no medical underwriting, so you can never be denied coverage for health or financial status for a Medicare Advantage plan. You must, it must cover everything that original Medicare does. So you're not getting any less of coverage for anything. All plans must have a maximum out of pocket to limit the financial exposure for beneficiaries. And I think that's really key and important. Why one of these plans do work well for individuals is because it doesn't give you the exposure like original Medicare does, which is unlimited. This insurance, again, will privatize your Medicare. So that's something really important to understand. And you will have cost sharing. A lot of times you have low cost premiums or zero cost premiums, small copays and small deductibles. And the plans also, in terms of your pharmacy, will have networks of pharmacies that are considered preferred pharmacies, as well as a preferred provider network that you might have requirements to get services from. So Medicare Advantage Plan Part D. So this is Part D is your prescription drug option, and it is not a part of original Medicare. You do have to get and pay for a Part D plan outside of on your own, and you get those plans. They're called PDPs, or through a Medicare Advantage plan through private insurance carriers. Costs and drug coverage varies by the plan, so it's super important to find out if your medications that you're taking are on the same formulary that the plan offers. Again, Part D isn't required, but if you do not enroll, you will be facing a penalty if there's ever a time that you decide to enroll in Part D. So as a part of Part D, the cost of prescription drugs this year, on prescription drugs, the maximum out of pocket for Medicare Advantage plans, as well as prescription drug plans, is $2,000. There's three stages to each plan. So the first phase is a deductible plan, which is the point where you're going to have to pay a little bit out of pocket in order for the plan to start covering your drugs at a cost sharing phase. The initial coverage phase is where you would be paying your share. Depends on what level of medication you're taking. If you're on generic, it's usually $0. But if you're on branded or specialty drugs, you're going to be paying a cost share. And then there's this thing called a catastrophic phase. And that catastrophic phase, you will reach when you reach the max out of pocket of $2,000 for the plan year, after which your medications are covered for the rest of the year at a zero cost for you. For the prescription drug plans, your max out of pocket, your deductibles and copays, they reset every year. And sometimes there's changes every year to your deductible as well as your max out of pocket. So it's super important to, again, review your plan. They usually send you paperwork called an ANOC, an annual notice of change. So it's super important to read that paperwork every year. Most people file it in the recycling bin called the trash can, but super important to read through it on an annual basis. Here's just an example of the tiers. Tier 1 of medications is called preferred generic, usually zero cost. Non-preferred generics is tier 2, has a little bit more cost. Tier 3, 4, and 5, as you get higher in the tiers, the cost share goes up. With most of the Medicare Advantage plans privatized, tier 1 and tier 2 oftentimes are $0 costs. And for most of your generic drugs that are out there. So again, important facts about Part D plans. You must be enrolled in Part A and Part B to purchase it. It has to be purchased by a private insurance company. For Part C, usually the prescription drug plans are embedded in Medicare Advantage plans. And covers drugs that are most commonly prescribed to Medicare beneficiaries. It can cover generic as well as brand, but each company has their own formulary, so it's super important to remember that. Your prescription drug plan also covers your vaccines. So any of your over-the-counter vaccines that you take can be covered on there. And you may be liable for Part D penalties if you, again, do not enroll on time and you use a SEP or a special enrollment period. So again, Medigap insurance as well, also known as Medicare Supplement, which was our option 1. Again, it helps pay for some of the costs of your Medicare Part A and Part B. The premium and cost sharing vary by the plan, are subject to annual rates increases. As of late, annually, we've seen anywhere from a 7 to 10% plan and premium change on an annual basis. There are 10 standardized Medicare supplement plans. It does not matter what insurance company you get it from. The plans offer the same level of benefit. Um, Sometimes you'll hear letters like, I have a plan G, I have a plan F, an N, an L, an M. So those are just different levels of the standardized Medicare supplement plans that you can opt to purchase. Um, the best time to actually get a Medicare supplement plan, if you're choosing to, is at the age of 65, because there is medical underwriting after your initial enrollment period at 65. You would have to go through medical underwriting. So for those people that have a chronic illness or have had some long-term health issues, you may be denied getting that coverage, or you may be paying a higher premium on a Medicare supplement plan. Um, Remember, when you get a Medicare supplement plan, dental, vision, prescription drug coverage, you have to purchase it individually and independently from a private insurance company, and it will add to your premium costs. So Medicare supplement plans, they're offered based on the state that you live in. Not all states offer all plans. Again, there's no medical underwriting for 6 months once you've enrolled in Part A and Part B. They help to offset the cost of your original Medicare and cap it. And the good thing about a Medicare supplement plan is it's a national network. What that means is you can go to any provider, any hospital, as long as they take Medicare. There's no provider network. As long as the doctor and the hospital takes Medicare, you're good to go and can get services from anybody. So just a brief overview of insurance costs that you may incur on Medicare: a monthly premium that you would have to pay, potentially a deductible, which is a set amount that you'd have to pay for services before your coverage begins, a co-insurance, which is a percentage, for example, 80/20, where the insurance company would be paying 80% and you would be paying 20% of the cost, and then co-pays, which are small amounts to get services. So for example, if you had to go see a specialist, you may pay anywhere from $10 to $40, depending upon the plan that you choose. So as we look at just overview of Medicare Advantage supplements, Medicare Advantage class, many of the Medicare Advantage are $0 premium to a minimal premium for the plans. It's all inclusive, has few deductibles, copays, and co-insurances. Prescription drug plans, again, a small monthly premium that also has deductibles and copays. And then Medicare supplements, it has a monthly premium. It can have a deductible and a copay attached to it as well. So I put a chart in here to say it's always confusing as to why or what should you choose for yourself. And this is a very general chart, obviously talking to someone and discussing what's right fit for you. But here's a chart just kind of discussing the difference between Medicare Advantage and Medicare supplements. You know, cost and convenience and what works for you is important. And also your current health status. If you're going into Medicare and you're 65 and you've maybe dealt with something like cancer or something like you've had open heart surgery and you know do see the doctors a lot, or you travel a lot and you spend 6 months here in Ohio and you spend 6 months in California, and so you don't want to be tied down to a network, that may be a reason for you to choose a Medicare supplement versus someone who may be living in Ohio, not traveling so much, and they like the doctors that they have. They might choose a Medicare Advantage plan because they're in relatively good health. They're not paying a whole lot of out of pocket right now. And they want to take advantage of a kind of a one-stop shop where all of their benefits are through one carrier and they're not having to pay all these premiums outside. So financial assistance programs. So this again are for individuals that are joining Medicare and do have limitations on income, and benefits can be given to you through the extra help through Medicare for a prescription drug. You can also do what's called Medicaid. What happens is that if your income is below a certain level of poverty level, they will give you what's called Medicaid full benefits. And in addition, you can also qualify for a Medicare savings program. And the Medicare savings program can help you pay for your premium costs for Part A and Part B. So for those that have limited income, again, that may be falling in a super low income, they can qualify for that, and that hopefully can help, increase their Social Security check, and they're not paying the premium. Again, the Medicare Savings Program, it's administered by the state, so you'd be calling in Ohio, for example, the Ohio Medicaid office, and speaking to them and letting them know you're on Medicare and would like to enroll in the Medicare Savings Program. And I'm going to open it up for questions at this point. If there are any questions, we can discuss them. And again, this is my information. My name's Sejal Patel, and I am an independent Medicare advisor, which means I have insurance brokerage benefits for all companies that are in Ohio, where I can look at all plans and help find the right fit for you. And I also work with clients similar to this, where I just did this education piece for you guys as a general. I do a lot of one-on-one education, kind of talking through people's special needs to help promote care for them. So let's see, any questions? Let's see if I can take you guys off of mute. It doesn't look like, is there any questions? I can't hear. Can you guys hear me?
I don't think so. There are any questions.
Okay,
I don't
perfect.
see them.
Okay. I'm gonna stop recording real quick, and then I'm gonna talk to you.
Thank you so much.
Yes. So I will edit and send this out to you, the link.
Sure,
Hopefully when I get back on Monday,
sure.
I can do that. So
I can share it everywhere.
yes, and I appreciate your partnering with me. I just think it's, obviously I gave details, but it's pretty complicated, I would
Yes.
say. Most people have a really, they think they know, and then they get into it and they're like, oh.
Yeah. Yeah. It looks complicated. Yes.
Yes. So it was very nice talking to you again.
Same here.
And I'm gonna be out in June, probably for a few weeks, end of June through beginning of July. So I'll maybe reach out to you a few weeks before just to meet up with you in person. Because
Sure.
you live in Cleveland, right?
Yes.
Okay. Yeah, would totally love to meet with you in person.
Sure.
All right.
Same here.
Okay. You
Yeah.
take care. Have a great
You
day.
too. Yeah.
Bye.
Thank you so much. Bye.
Bye. Ms. Ficaria, can you hear me? Are you still there? Ooh.